Okay, good morning. I'm Dr. Deuk. I'm here with one of my lovely patients who actually had back surgery 6 weeks ago almost now.
Yes.
And she had a fusion, a Deuk spine fusion, which is very different than most other fusions. And by saying it's a fusion, we're simplifying the surgery. There was a lot of things that had to be done in there that had nothing to do with fusion, that had to do with decompression and realignment of the spine. These are techniques that I developed myself over the years that have improved the outcomes for patients. So now tell us about your lumbar fusion. Were you in the hospital for that surgery?
No, not at all.
Right?
The surgery done at the surgery center right here in Vieira.
Yes, at the Deuk Spine Institute Affiliated Surgery Center. So were you here overnight or did you go home right after your surgery?
I go home. I went home right after the surgery.
Yeah, that's right. So we did your surgery outpatient, no hospital stay. And you came in and had surgery for what reason?
For lower back pain and sciatica nerve pain since October 2018, which radiate all the way to my lower leg, left leg, all the way to my ankle.
And do you still have that back pain that you had before the surgery?
No, not anymore.
It's gone.
Gone.
Cured.
Yes.
And the leg pain that you had, is that still there?
No, no more.
The pain's gone. So
Yes.
do you believe that back and leg pain can be cured with surgery?
I totally believe so.
As long as it's done properly.
Yes.
Yeah,
Yes.
that's correct. And so you're 6 weeks after surgery now, and we talked about going back to work. Are you excited about doing things now?
Yes. And I'm excited because I can do a lot of things now. Before, I cannot even stand for more than 15 minutes. Or, and after work, I have to lie down. And now I can stand to cook because that's one of my hobbies. And I can, go for a walk. And I don't have to lie down in my sofa after work anymore.
Wonderful. I'm very happy for you. Anything else you want to say to the world before we wrap this up?
I highly, highly recommend Dr. Deuk. If you have a back pain like me, suffering, it can be fixed. And I'm totally confident in Dr. Deuk. Fix my back, and I'm so grateful.
You're welcome.
With all my heart.
You have somebody else you want to thank too, right?
Yes.
Your sister?
My sister, all the nurse that, Dr. Deuk sent, the home health nurse, and all the staff here. And also next door, physical therapy.
Yeah.
Everybody is so nice, so professional, and they go, beyond to help me.
Well, and her sister came out and took care of her for a few weeks after surgery, which I thought was very important, and it was incredible. She came from California, and she had to use her vacation time to do that. So you have a great sister and great family, and I think you're going to do fantastic. So
Thanks so much, Dr.
you're
Deuk.
welcome. All right. Good to see you.
Yes.